Hello everyone. Today we are going to discuss about an important disease which is called multiple sclerosis actually. So this multiple sclerosis is very important disease, though it is rare but it's very important. So let us dive into the topic. So let us begin with the definition of the disease actually. As we have already have a kind of insight about the disease, this disease is a kind of progressive demyelinating disease. So this means the disease is affecting the myelin sheath actually. So progressive demyelinating disease of the central nervous system that actually disrupt the, the, the transmission of signals within the central nervous system. Because if the myelin sheath is damaged actually, so definitely signals of central nervous system cannot be coordinated well. So that is it. And then this disruption of the myelin sheath of the central nervous system yield a variety of symptoms which include mental symptoms, physical, and psychiatric symptoms actually. So that is it. So now let us see the etiology. What causes this demyelinating disease? That is this multiple sclerosis actually. The etiology of this, as we have already know in the case of many neurological diseases, is actually idiopathic. We don't know the cause, but we know the risk factors. The risk factors may be genetic or actually environmental. So risk factors may be genetic or environmental factors actually. Environmental, that's a genetic predisposition and environmental predisposition. So this genetic actually it is associated with inheritance of some kind of genes in HLA, DR15, and HLA DQ6. So these are the genes that are associated with the multiple sclerosis actually. And also environmental factors, for example, infections, chemicals, but mostly specifically to be infections with a with a viruses, with some of the viruses like HSV infection, like Epstein-Barr virus actually, and then like measles, mumps, and rubella. So infection to uh, these viruses actually can put the person at risk of developing this multiple sclerosis actually. So that is it. So now let us see the pathophysiology. Pathophysiology. In the pathophysiology of multiple sclerosis, what is believed to be uh, among the factors that causes this demyelination actually is unregulated immune system. That is an autoimmune cause actually, in which T cell mediated inflammation and then damage to the myelin sheath in the central nervous system actually. So this is what is believed to be the pathophysiology. And when this inflammation occur, instead of the myelin sheath to recover actually, sometimes it do recover actually, but as time goes on, since we say from the definition it's a progressive thing actually, the inflammation still come back again after after the remission of this inflammation, then the inflammation reoccur after some times actually. So this repeated inflammation and then disruption of the myelin sheath lead to the result in actually formation of plaque. So that is it. Formation of plaque in the CNS. So this plaque definitely, instead of myelin sheath, then definitely the myelin sheath is going to be substituted with a kind of plaque. So that is it. So now let us see some types of this multiple sclerosis. Types of MS. Let me abbreviate it as with MS actually. So The multiple sclerosis is divided into four. Number one, we have clinically isolated MS. In this clinically isolated MS, actually, the attack of the central nervous system is happening in the central nervous system, but the symptoms actually in that patient do not meet the criteria to diagnose that patient as having multiple sclerosis. That is why it is called clinically isolated. Some didn't used to actually mention this clinically isolated as type of multiple sclerosis. So, but in some textbook, actually they put it in the type of multiple sclerosis. The attack is happening in the central nervous system, but you can't actually uh, exactly confirm or the patient didn't meet the criteria of to be diagnosed with this multiple sclerosis actually. While we have the other one called relapsing remitting multiple sclerosis. When we say relapsing remitting, is that we mean that in this type of multiple sclerosis, there is often complete remission of the symptom for almost period of months to years actually. When the symptoms occur, then there will going to be a period of asymptomatic period for almost up to months or even years without the symptoms, and then later on the symptoms will also relapse, that is come back. That's why it is called relapsing. It has a relapsing phase, the symptoms has a relapsing phase and then remitting phase. In some period the symptoms will come back and then they will go on by themselves actually. After some period of time then the symptoms occur again, right? So that is called relapsing remitting multiple sclerosis actually. While number three, we have primary progressive multiple sclerosis. In primary progressive multiple sclerosis, actually, this is associated with progression and then worsening of the symptoms from the onset without even a minor period of remission, actually. What I mean here is that these symptoms, from the time the patient started to experience the symptoms, he will never have any phase of remission. From the onset up to the patient, up to the point where the patient will go to the hospital, up to the patient where the patient will go to be diagnosed with the multiple sclerosis, actually, he will not have any period of remission. So anytime the symptoms are there, right? So that is it. This is what we call the primary progressive. And then and from the word progressive, always the symptoms are getting worsened, right? So that is from the definition, actually. So number four, that's the last category. We have secondary progressive multiple sclerosis, progressive MS. When we say secondary, it means that from the word secondary, actually, this occur in the patient who has this type, that's relapsing remitting multiple sclerosis. When the patient earlier in the course of the disease, when he has this relapsing and then the remitting multiple sclerosis, later on, after some certain amount of years, like up to even 19 years or 20 years, then it will now change to type of multiple sclerosis without remission and relapsing period. Now it will going to be, the symptoms will going to stay constant without going. So since this disease, this type changes from relapsing to remitting to the kind of type of multiple sclerosis without remission and relapsing period, so now it is called secondary progressive. The difference from this is that in this primary progressive multiple sclerosis, the patient didn't have any other type. Always from the onset of the disease is always progressive without any period of remission. While in secondary progressive, the patient at first have this type and then it changed to this progressive without then remission after 19 years, 20 years actually. So that is the type of multiple sclerosis. So now let us see some symptoms. Some symptoms of multiple sclerosis. Signs and symptoms. There are a lot of variety of symptoms actually. Number one, we have visual symptoms. We have visual symptoms actually. So among the visual symptoms actually there is a kind of nystagmus. When we say nystagmus, means a kind of random movement of the of the eye, actually, of the eyeball, due to irritation of the myelin in the nerves that are controlling the extraocular muscles of the eye, actually. So we have the nystagmus, we have a kind of sometimes diplopia. So this is a kind of visual symptoms, actually. So we have another symptoms that are associated with this multiple sclerosis, which is sensory symptoms, because this this demyelination is not only happening uh, in a specific in a specific nerves in the central nervous system, but it is affecting the nerves in the central nervous system generally. That is randomly, actually. So any type of nerve, be it sensory, be it motor, can be affected, right? So that is it. So there is a kind of sensory symptoms. Sensory symptoms. When we say sensory symptoms, we mean symptoms that are associated with the damage to the neurons that are carrying sensation. So this patient will be complaining of paresthesias. You'll be complaining of numbness, tingling sensation, complaining of needle and pin sensation, needles and pins sensation in the skin, actually. So that is it. And then also sometimes he may even complain of burning pain, actually. All these are associated with the damage to the sensory neurons, actually. So we have speech problem, speech impairment. So this speech impairment, actually, the patient will manifest as having dysarthria. That is difficulty speaking. So that is it. And then we have even swallowing problem. That is dysphagia. Swallowing symptom. So the patient will going to have a kind of dysphagia, actually. And then because the nerves that are associated with swallowing, they are impaired, actually. So that is it. Then we have musculoskeletal symptoms. Musculoskeletal symptoms. So in musculoskeletal symptoms, actually, we're going to have a kind of sign of upper motor neuron damage. So because it is the central nervous system neurons that are affected, right? So there are going to be a kind of symptoms of upper motor neuron damage, which is we're going to manifest as having spastic paralysis. Spastic paralysis. So we're going to have a kind of increased reflexes, that is hyperreflexia. Increased reflexes. And then it will show a kind of rigidity, kind of positive Babinski sign, Babinski's sign. So all this are signifying upper motor neuron lesion, actually. So that is it. And then there are autonomic nervous system problem. Autonomic nervous system damage. So this may manifest as either, for example, if you come to bowel movement, the patient may have a kind of diarrhea or constipation. Why? Because if sympathetic nervous system or sympathetic nerves that are inhibiting the bowel, actually, if the sympathetic are the one that are more damaged than the parasympathetic nervous system, the patient will going to complain of diarrhea. But if the damage to the parasympathetic nervous system is more than the sympathetic, then definitely the patient will going to have a kind of constipation. So depending on which one is more damaged than the other. So that is it. Then we have another symptom of lack of urinary tract symptoms. That is the urinary tract symptoms. So the patient will going to have a kind of urinary incontinence, or the patient will going to have a kind of, if not urinary incontinence, will going to have a kind of urinary retention. So depending on whether if parasympathetic nervous system or sympathetic is more damaged than the other, actually. So that is it. Then now let us see the diagnosis, or how you can diagnose the patient with MS, or if you are suspecting multiple sclerosis. Based on the symptoms, mostly the patients that are affected with multiple sclerosis are female actually. So diagnosis. So for you to confirm your diagnosis, you have to perform a kind of imaging. So based on imaging, specifically, most accurate one is MRI, magnetic resonance imaging, actually with gadolinium as a contrast. With gadolinium. So that is it. This can help you see that plaques, because in the pathophysiology we see that there are plaque formation actually. Then also CSF analysis, that's lumbar puncture, right? So in the CSF analysis actually, you will find a kind of oligoclonal band of IgG in the CSF. So this is very characteristic or classical of multiple sclerosis actually. So that is it. Then we have some kind of phenomena that are associated with this multiple sclerosis called limit signs, and then the autopsy sign. So this limit sign is that when the patient is bending or bending back, there will going to be a kind of electrical sensation that runs down the back. So electrical sensation with bending back. So when the patient bend on his back, bending, so if he bend, then definitely he will kind of experience a kind of electrical sensation that runs down from the top of his back down, right? So this is called limit sign actually. So we have another sign which is called autopsy sign or autopsy phenomenon. This autopsy phenomenon actually, this is a kind of worsening of symptoms after exposure to a kind of hot or hot temperature. So worsening of symptoms. The patient will complain to you about the symptoms get worsened when he exposes himself to kind of hot temperature, worsening of symptoms when exposure to hot temperature actually. For example, maybe sunlight, for example, e.g. sunlight. So then now treatment. So for us to treat this multiple sclerosis in acute attacks, actually for acute attacks, methylprednisolone is very important. So for acute attacks, we administer a kind of IV methylprednisolone, and then adjunct it with a kind of plasmapheresis. But this plasmapheresis actually is going to be only carried out when the patient is unresponsive to this methylprednisolone. So there are kind of disease modifying therapy. So this multiple sclerosis can be modified with a kind of disease called with a kind of drug called interferon 1A and then interferon 1B. So this is given subcutaneously, while this is given IM actually. But for pregnant woman, we have to use a kind of drug called diatrema. This for pregnant woman. So that is it. So this is the end of this lecture actually. Thank you very much.